Welcome to Section 4 of Public Health Sciences. In the other videos in this chapter so far, we've been discussing principles and concepts. However, there are so many ethical situations that you may be presented with on Step 1 that can be incredibly challenging to deal with. In this section, we'll be reviewing specific ethical scenarios that you may have to face on Step 1 and how to deal with them. Let's get started. There are a lot of ethical situations to cover in this section, with no real unifying theme for organizing them. We'll go through about half of the concepts using a rapid-fire approach, which should hopefully help you be more familiar with the key points of each scenario. And then for some of the trickier scenarios, we'll transition to practice questions, which will hopefully allow you to think about the issues more thoroughly. The first scenario concerns a patient who thinks his food is radioactive. In a situation such as this, where a patient has a fixed belief without evidence, it is important to gain more information about the patient's belief and attempt to work through them. For this patient, questioning why he believes his food is radioactive and then attempting to work through the reason for this belief would be the first step. You should always be careful not to quickly dismiss or try to explain away someone's beliefs, no matter how far out they may seem. The second scenario involves a doctor who doesn't wish to prescribe emergency contraceptives for religious reasons. In this case, the doctor should not be forced to prescribe these medications. However, he or she should explain to each patient the full range of options available and should refer the patient to a provider comfortable prescribing contraceptive medications, if this is what the patient wants. This way, both the doctor and patient autonomy can be respected. The third scenario involves a patient with cancer and a history of opioid abuse needing pain relief. In the case of a cancer patient, comfort should be given first priority, especially if he or she has a terminal diagnosis. It's usually immaterial in this case that the patient has a history of opioid abuse. The opioids should be given until the patient is comfortable. The last scenario is a teenage male with a strong sex drive, who may be spending a lot of time thinking about girls and masturbating daily. In this case, there is nothing medically wrong and his behavior is age appropriate. Reassurance is the best course of action. The next scenario involves a friend who wants to be with a patient despite a family-only sign barring their entry. In this case, it's important to ask the patient for permission to allow the friend in, whereupon it is acceptable to make an exception for close friends. For the next scenario, conflict between two physicians generally should be resolved with direct communication between the two parties. If a resolution cannot be achieved with a direct dialogue, then hospital supervisors should be involved. If there is one physician who is doing something unethical, this is a different matter and should be addressed in a way that we'll discuss later in this lecture. For patients who want to try alternative or holistic medicine, it's important to understand what the therapies are and if there are any risks involved in their use. If not, and they don't interfere with treatment, then it's okay to allow patients to pursue these therapies. For a baby born with a lethal condition, it's okay to let the mother feed the baby if it's sucking. Everything possible should be done to ensure the comfort and soothing of the dying child. Even if the baby will not live, it's generally helpful for the mother and family to provide comfort care for the infant for as long as it lives. This helps with the grieving process and helps ease any guilt the family might otherwise feel. For a patient who either you suspect or who admits is a victim of partner abuse, it's important to gain more information by asking if the patient is safe and whether he or she has an emergency plan. It's not necessary to disclose the abuse to the authorities or pressure the patient to leave their partner, but you should remind the patient that you're there for them to help provide options. Remember, there is an exception, however, which we discussed in the last video, which is when an elderly person is being abused. This must be reported to the authorities. For a child whose injuries are inconsistent with the described trauma, who you suspect is being abused, it's imperative to ensure that the child is in a safe location and report the abuse to Child Protective Services immediately. For the next scenario, you might encounter a father who objects to emergency treatment for his wife and 16-year-old daughter. This could be for religious reasons or for some other personal belief. In this case, he is able to make decisions to withhold emergency care for his wife unless she has some kind of advance directive or has designated a different person as a surrogate decision maker. However, he does not have authority to deny emergency care for his daughter. Minors cannot be refused emergent care based solely on belief. Finally, you may encounter a scenario involving a young child who believes the death of a sibling to be his or her fault and feels guilty. You should avoid cliches and euphemisms such as, "your sister is in a better place," or "she has moved on." Children of this age are able to comprehend the permanence of death and should be counseled directly that their sibling has died, but reassured that they are not responsible. You should also encourage play and healthy coping behaviors. Okay, now that we've gone over roughly half of the scenarios using our rapid-fire approach, let's get into some practice questions for some of the trickier scenarios. A 49-year-old patient presents to the emergency department complaining of a cough. You walk into the room ready to examine the patient. The patient explains to you that she is Muslim and would prefer not to be examined by a member of the opposite sex. What should you do? A. Explain that you are just as qualified as a female provider and that the patient should go elsewhere if that is an issue. B. Find a female chaperone and continue with the exam. C. Ensure the patient is stable and then refer her to a female provider who can perform the exam. D. Skip the physical exam and treat the patient based on history and other testing. Hopefully from the question stem you notice that there are a couple of ethical principles that are being balanced in this scenario. First, you want to respect the autonomy of the patient by allowing her to make decisions about the care she would like to receive. However, you also want to do what is best for her and provide what care you can in accordance with the principle of beneficence. In this situation, C is the best answer. This is because the patient's autonomy is the overriding principle in this non-emergent situation. So as long as she is stable, it's appropriate to refer to a female physician rather than compromise your own standard of care or violate her stated wishes. So again, the correct answer is C. Ensure the patient is stable and then refer her to a female provider who can perform the exam. A is wrong because you should not violate the patient's autonomy by insisting she be examined by you. If she appears stable, there is no reason for you to violate her wishes in this regard. B is wrong because the patient has requested a female provider, not the presence of a chaperone. D is wrong because it would be inappropriate to make a diagnosis and initiate treatment without performing a thorough physical examination. All right, let's move on to another question. A 60-year-old patient presents to the clinic demanding to have his gallbladder removed. He has been having abdominal pain for years, but has consistently had normal labs and imaging, including at this visit. You tell the patient that it is unlikely that the procedure will help with his symptoms, but he insists that he have it done anyway. What is the best course of action? A. Refuse to perform the procedure and explain to the patient that it would be an unnecessary expense and risk to his health. B. Refer to another physician for a second opinion. C. Ask the patient why he thinks a cholecystectomy would be helpful. Or D. Schedule a cholecystectomy after explaining the risks and benefits of the procedure. Okay, when a patient demands a procedure that may not be necessary, it's important to approach the situation with empathy and understanding and attempt to find out why the patient wants this particular procedure done. So in this case, the correct answer is C. Ask the patient why he thinks a cholecystectomy would be helpful. A is wrong because an upfront refusal without attempting to understand the patient's reasoning would be inappropriate and would likely undermine your relationship with the patient. B is wrong because you can make this decision on your own without requiring a referral to another physician. D is wrong because you should not schedule a cholecystectomy if you truly believe the procedure to be unnecessary. So again, the correct answer is C. All right, let's do another question. A 45-year-old obese male patient presents to clinic complaining of an intense pain in his foot. On exam, you discover that the first metatarsal of his left foot is painful, swollen, and erythematous. The patient has had this condition before and has brought paperwork for you to fill out for a disabled parking permit so that he won't have to walk quite as far from his car to his office. What is the best course of action? A. Refuse to fill out the form and explain that with the proper treatment and lifestyle changes, the patient won't experience any more issues. B. Fill out and submit the paperwork as the patient is clearly in need of assistance. C. Ask the patient whether he thinks it would be ethical to get a disabled parking permit for his condition. Or D. Call the Department of Motor Vehicles to ask about the policies regarding disabled parking permits. Okay, this patient is asking for a parking permit for gout, which is an inappropriate request and should be refused. The best answer, therefore, is A. Refuse to fill out the form and explain that with the proper treatment and lifestyle changes, the patient won't experience any more issues. B is incorrect because gout is a temporary condition for which a disability claim would be unnecessary. C is incorrect because there is no need to ask the patient what he thinks about the situation, as you should be able to explain to him that it is a temporary situation and does not qualify him as disabled or in need of a parking permit. D is incorrect because, as the physician, you should be able to make a determination about his need for disability benefits without consulting the DMV. Generally speaking, it's rarely the correct answer to consult with someone else when answering multiple choice questions about ethical scenarios. So again, the correct answer is A. All right, let's move on to the next question. You are rotating in a sports medicine doctor's clinic during your third year clerkship rotations. As you observe the physician practice, you notice that almost every patient gets referred to an orthopedic surgeon, even for relatively minor issues. When you ask the physician about this, he explains that he has an agreement with the surgeon that benefits the practice financially for every patient he refers. He tells you not to worry because the surgeon only performs surgeries that are absolutely necessary. What is the best course of action? A. Report this physician to the state licensure board as he is accepting unethical kickbacks for referring patients inappropriately. B. Express concern and encourage the physician to at least disclose this arrangement with his patients so that they are aware of this potential conflict of interest. C. Do nothing as medicine is a business and arrangements like this are common, or D, call the surgeon's office and urge them to end this arrangement. Okay, this physician's actions, while not overtly harming patients, are not ethical. In this case, encouraging the physician to at least disclose this arrangement with his patient would be the best course of action. So B is the correct answer. Express concern and encourage the physician to at least disclose this arrangement with his patients so that they are aware of this potential conflict of interest. A is incorrect because reporting the physician to the licensure board would be an extreme reaction to this behavior, although it would be appropriate in situations where the physician's actions were dangerous. So A is incorrect. C is incorrect because in this situation, it is incumbent upon you to do something despite the imbalance of power between you and the physician. Business arrangements like this may be common, but if you observe a high volume of referrals even for minor complaints, then you should act to protect the interest of the patients. So C is incorrect. D is incorrect because the situation should be addressed with the physician with whom you are acquainted. You should avoid going behind the physician's back to address the issue with his colleague. All right, let's do another question. A 26-year-old patient presents to the emergency department after sustaining significant trauma in a motor vehicle accident. He is in hypovolemic shock and requires a blood transfusion. However, he declines this intervention as he is a Jehovah's Witness and it contradicts his religious beliefs. What should you do? A. Transfuse the patient as his condition is life-threatening and the situation is an emergency. B. Find out more about the patient's beliefs and attempt to explain to him the importance of the blood transfusion, but do not transfuse against the patient's wishes. C. Call the patient's family to have them convince him to accept this intervention. Or D. Consult the hospital ethics board to determine whether or not the patient should be transfused. Okay, this question is similar to those we encountered in previous lectures about consent and capacity. In this case, the patient shows no signs of lacking capacity and has refused a life-saving intervention. Although he is likely to die without it, he is able to refuse this intervention and his decision should be respected. So the correct answer is B. Find out more about the patient's beliefs and attempt to explain to him the importance of the blood transfusion, but do not transfuse against the patient's wishes. A is incorrect because the patient is a competent adult and can decide to refuse life-saving intervention. C is incorrect because calling the patient's family to have them convince him to change his mind would not be respectful of the patient's autonomy and would violate patient-doctor confidentiality. D is incorrect because, as usual, it is not necessary to involve the hospital ethics board in a straightforward case of a competent patient refusing care. Okay, let's do another question. A 75-year-old patient has test results that indicate she has a terminal condition with a life expectancy of less than 6 months. Her family asks you not to disclose any test results that indicate a poor prognosis, as they don't think the patient will be able to handle it. What is the best course of action? A. Withhold the test results from the patient in accordance with the family's wishes. B. Explain that you must divulge the test results to the patient as long as she has decision-making capacity. C. Attempt to understand why the patient's family would like to withhold this information from the patient, and then make a decision based on this information. D. Repeat testing to ensure that your results are valid. For this question, it's important to remember that you must disclose any relevant health information to the patient in almost every circumstance. The only situations in which it might be appropriate to withhold information is if the patient is not competent or if you need to invoke therapeutic privilege because you may believe the information may cause the patient to harm themselves or others. In this case, it is not appropriate to blindly accept the family's wishes, but it is appropriate to get more information from the patient's family to determine whether the patient either lacks capacity or is at risk of harming herself or others. Therefore, the best answer in this case is C. Attempt to understand why the patient's family would like to withhold this information from the patient, and then make a decision based on this information. A is incorrect because, as previously stated, more information should be obtained before deciding whether or not to acquiesce to the family's wishes in this situation. B is incorrect because, in the case of therapeutic privilege, it may be appropriate to withhold information from the patient. D is incorrect because there is no reason to suspect that your test results are invalid and therefore no reason to repeat them. This situation might be handled differently in different cultures, so again, the correct answer is C. All right, let's move on to another question. A 15-year-old patient presents to your clinic with a positive pregnancy test, hoping to establish prenatal care. Her parents have accompanied the patient and brought adoption paperwork, insisting that the patient begin preparing to put the child up for adoption. Your patient is adamant that she would like to keep the child and raise her. What is the best course of action? A. Respect the patient's wishes and refrain from participating in any preparation for adoption. B. Attempt to persuade the patient that adoption is the best course of action as she is underage and a child would likely represent a significant burden. C. Present all options to the patient, including termination of the pregnancy. D. fill out the adoption paperwork as the patient is underage and therefore her parents have legal decision-making authority over her. Okay, mothers have the right to make decisions regarding their babies unless they're judged to lack capacity or ability to care for them. While parents of minors generally make medical decisions on their behalf, the minor in this question still has decision-making capacity for her child. While it is appropriate to provide more information to the patient as suggested, you should absolutely respect the patient's wishes and refrain from participating in any preparation for adoption, as represented by the correct answer choice A. B is incorrect because it is also inappropriate to attempt to persuade the patient to pursue any specific course of action, especially in the case where the patient might feel ganged up on by you and her parents. C is incorrect because it is likely that the patient is aware of her options, and in this situation, you must serve as her advocate and not jeopardize your relationship with her by presenting her with options which could be interpreted as an attempt to change her mind. The patient clearly wants to continue with the pregnancy and keep the baby, so suggesting termination of the pregnancy would be inappropriate. So C is incorrect. D is incorrect because, as previously mentioned, people under age 18 have the decision-making capacity for their own children, and the parents are not legally authorized to decide the fate of the baby. So again, it's important to, above all, respect the patient's autonomy and right to make this decision for herself. Okay, let's move on to the next question. An attractive 26-year-old female patient repeatedly presents to your office complaining of breast tenderness. You have performed multiple physical examinations with imaging and laboratory testing with no significant results. The patient thanks you and states that she feels reassured to have such an incredible doctor taking care of her. She asks if she can take you to dinner to express her gratitude. What is the best course of action? A. Accept the invitation as an appropriate expression of the patient's gratitude. B. Attempt to clarify with the patient whether she is asking you on a date or whether the dinner will respect your physician-patient relationship. C. Politely decline the invitation as it is unethical to enter into a romantic relationship with this patient. Or D. Accept the invitation but first transfer care of the patient to a different physician as it is acceptable to date former but not current patients. Okay, while dating a patient is generally not illegal, it's still unethical. There is some nuance involved in these scenarios, as it is technically okay to date a former patient. However, the AMA guidelines state that sexual or romantic relationships with former patients are unethical if the physician uses or exploits trust, knowledge, emotions, or influence derived from the previous professional relationship, or if a romantic relationship would otherwise foreseeably harm the individual. For the purposes of step 1, it's generally a good idea to go with the most conservative approach, which in this case is answer choice C. Politely decline the invitation as it is unethical to enter into a romantic relationship with this patient. A is incorrect because there is clearly more going on here than a simple expression of the patient's gratitude, and dinner would likely lead to the development of a potentially inappropriate relationship. B is incorrect because there is no need to ask the patient what her intentions are, and a decision should be made based on the information in the vignette. D is incorrect because while you could transfer care to another physician and still technically date the patient, there are a few indications from the question stem, such as repeat breast exam requests and praising the physician, that suggest that perhaps there may be a potential power imbalance or emotional influence derived from the physician-patient relationship that would make any romantic relationship inappropriate. So D is incorrect. All right, next question. You are an oncologist working in a hectic outpatient clinic and you accidentally perform a bone marrow biopsy on the wrong patient. What should you do? A. Provide free medical care to that patient for the next year to compensate for the mistake. B. Explain to the patient that an error occurred, but do not admit fault because to do so would risk unnecessary liability. C. Explain to the patient exactly what happened as you understand it and apologize for your error. Or D. Monitor for any adverse effects, but do not disclose the error because the patient will likely experience minimal harm from this mistake. In the case of medical error, you have to be upfront and disclose the error. Never attempt to cover it up or dodge responsibility for your mistakes, even if no direct harm was caused to the patient. In this case, the answer is clearly C. Explain to the patient exactly what happened as you understand it and apologize for the error. A is incorrect because there is no need to provide free medical care to the patient as compensation for the mistake. This would not necessarily be an inappropriate form of compensation, but the most important first step is to explain what happened and apologize. So A is incorrect. B is incorrect because, as previously stated, you must be upfront and admit responsibility for your mistakes despite liability concerns. D is incorrect because the outcome of mistakes should not dictate your behavior with regards to disclosing and apologizing for them. So again, the correct answer is C. All right, let's do one more question. You notice another physician in your practice appears intoxicated. The previous week, a patient that usually sees this physician presented to you for another issue, and you notice that the patient had been prescribed the wrong dose of a medication. What is the best course of action? A. Confront your colleague and see what you can do to help. B. Report your colleague's behavior to a supervisor and have them investigate the issue formally. C. Do nothing, as your partner is an adult and is responsible for their own actions. Or D. Report your colleague's behavior to the state licensing board and recommend license suspension. While conflict between physicians is generally best handled with a direct two-way conversation, in a case where the physician is impaired and this impairment has caused harm to patients, you are obliged to report the situation to the appropriate supervisory personnel. Therefore, the best answer is B. Report your colleague's behavior to a supervisor and have them investigate the issue formally. A is incorrect because, while it may be appropriate to offer counsel to your colleague, your duty is primarily to protect and serve patients, and therefore a physician who represents a threat to patients should be reported. C is incorrect because it is incumbent upon you to put the interest of patients first and report your colleague's potentially harmful actions. D is incorrect because a resolution should first be sought from your supervisors. If the situation is not resolved by local supervisors, then it would be appropriate to report your colleague to the state licensing board. So D is incorrect. And again, the correct answer is B. And with that, we've covered everything you should need to know about ethical situations.